Hey guys, it's Felicia with Felicia in Medicine. We're back again with another video. So today is Monday, July the 7th, and today your girl has officially started her third year, my first round of rotations, and I am on family medicine. And I know it's been a very, very long time since the last time I spoke with you, but I had to get acquainted. I had to get my feet wet with third year before I caught you guys up. So technically, our third year began on June 8th, where we started our Intro to Clerkship course. And pretty much that course is usually 4 weeks, but given everything that's going on in the world, that was condensed, being that we transitioned to a virtual platform. So that 4-week class then became a 2-week course, and depending on how you set up your schedule, it could have been spread across those 2 weeks or maybe more focused in 1 week. And so my courses and my sessions, because it was 5 sessions, they were pretty much condensed into 1 week. And I also had to, let me rewind. Part of that course, the Intro to Clerkship, basically we kind of talked about some of the fundamental things that we needed to become aware of before we started our rotation. So things of how to scrub in, we learned about hand washing, PPE, things of that nature. Very basic, fundamental things that we need to know for when we are on the wards. And lastly, we had to do our BLS, which we did between our first and second year. So this year was more focused on a recertification process, as well as the ACLS, which is for more advanced care services. So as if a patient is having a cold, meaning that they are under cardiac or pulmonary arrest, and you have to do CPR, looking at EKGs and things like that. So we actually had to go on campus for in-person running a mega code, and basically making sure that we knew the necessary interventions that we would do if a patient in fact did have a cold, looking at EKGs and seeing how we would intervene to try to resuscitate that patient. So that was really cool, and there was also a written portion for both the BLS and the ACLS that we had to pass before we could start our rotation. And again, like I said, today is July 7th, and I started my first day of clinical rotations, which was super nerve-wracking, super exciting, and everything in between. So I had to report there for 9 a.m., but I went early because, to be early is to be on time, and to be on time is to be late. And to be late is unacceptable. So your girl got there early, okay? And then after that, I got acquainted with some of the attending physicians, some of the medical assistants on staff, and I was able to see patients today. I was able to do history today. I really didn't do too much of physical exams. I did work alongside with one of the attendings and kind of mirror him as he was doing the physical example. When he was listening to the heart, he would allow me to listen to certain areas. Apartment M, y'all know the deal, for listening to the heart, things of that nature. And then another attending in the afternoon, she allowed me to be a little bit more independent. And so from the beginning, she was letting me enter the rooms and doing my history, my review of systems. And I was trying not to, panic. I held it down. So that was really, really good. But today overall was super cool. I will say that given the pandemic and everything that we're dealing with, one thing that I have to get used to is wearing the mask for 8 hours. So that was a lot. And what else? Being on my feet for 8 hours, pretty much everybody's been home and quarantining and staying at home, being safe and studying. So that's exhausting. So I'm really, really, really tired. And already one of my attendings gave me an article for how I would manage diabetes. So that's homework that needs to be prepared for tomorrow. But today was really cool because I was able to see a lot of different patients, a lot of different conditions, TIA, kind of going over blood pressure medication. So hearing them talk about our ACE inhibitors versus the beta blockers, I'm going to, review that again. Also, what else? A patient that kind of has like chronic pain and dealing with that and the management of that. And also, if you guys know and you guys remember, I am a candidate for a DO, so I'll be practicing osteopathic medicine. And so there was a patient, in fact, where one of my plans or idea and my suggestion to the the attending physician, being she was having respiratory problems and she had a lot of tight muscles. And immediately in my head, I was thinking of, we could do OMT. We could kind of try to figure out some muscle energy that we'll be able to do, such as rib raising, to kind of facilitate her to breathe better, to see if that would help her. But again, given COVID right now, they are limiting that type of intervention. But the attendant did say that was a good intervention. So, your girl was on it. I was on it, on the plan on what we should do. But overall, today was a good day. I'm really, really tired, but I'm going to keep you guys posted on what I'm doing. My goal for Philly Tea and Medicine is that I will be putting out a video on probably day 1 or week 1 of the rotation that I am on, and then followed up with how I thought the rotation was. So you should be expecting to hear from me 2 times a month. Let's hope that I keep that same energy. But again, I just wanted to come out here and, keep you guys updated on what's going on with me. This is a quick catch up, okay? Hold me accountable. Slide in my DMs at Philly Tea and Medicine. That's PHYLITINMEDICINE in Instagram, to be like, hey girl, make that video. As well as, let me know what you guys want to talk about. I don't know how much I can allow you guys to see on my day-to-day. As well as, like, subscribe, comment below what you guys want to hear, what you want to see, and also if you just want to give a little encouragement or whatever, I will appreciate that. So again, thank you so much for rocking with me and watching Philly Tea and Medicine. And remember to do what? Tell a friend to tell a friend to tell a friend and tell a friend to do what? Subscribe and Philly Tea and Medicine. Duh! Bye guys.